The western slope of Colorado, breathtaking red rock vistas, a clear view of the Grand Mesa, the charming streets of Grand Junction and smaller towns that dot this rugged landscape. 7 counties covering 17,500 square miles comprise the geographic reach of the Colorado Beacon Consortium, a cooperative federal agreement supported by local partners designed to build and expand the healthcare infrastructure. The region's 320,000 residents are a reflection of this remote spot that lies roughly halfway between Denver and Salt Lake City. Rugged self-reliance in the people is paired with a sense of community connectedness and collaboration. Colorado Beacon sprang from the region's history of resourcefulness to solve problems. The key problem, healthcare, is disconnected and has failed to use technology to transform care delivery.
Well, here in Western Colorado, we have long experience with collaboration amongst hospitals, payers, and physicians going back over 30 years. And so the Beacon opportunity simply gave us an opportunity to build on that collaboration, bringing additional resources to bear that we could use to take it to the next step in terms of what we've done historically.
The approach is simple. Comprehensive primary care providers and a neighborhood of supporting organizations adopt new payment models and use health information technology in a meaningful way. The idea is to enable primary care physicians to provide comprehensive care by offering them technology to make them more efficient, tools that can better predict health outcomes, prioritize interventions, and prevent disease. Physicians can then engage their patients at the personal, practice, and population levels. The community goal: achieve better care at lower costs and increase the health of the community. This benefits employers, taxpayers, and individual consumers.
What we've achieved through the Colorado Beacon Consortium is we've taken approximately 50 primary care practices in Western Colorado, and we've given them the tools and the resources and technology to really practice their trade at a higher level and provide better quality of care to their patient population. In addition, we feel that this higher quality ultimately will bend the cost curve and help reduce some of the medically unnecessary costs that we might see in our health system.
Our care is dictated by systems, not how bright or how well trained our physicians are. If we can improve our systems of care, i.e. transform our outpatient care, we will have a much greater impact on overall patient care.
Using health information technology can help inspire and light the fire in other physicians, because I think that it really gives you day-to-day feedback on how you're doing. You know, I think we have a general gestalt of I'm a good doctor, you know, I do this for my patient, I make sure I do the best I can every day. But I think that this lets you know in real objective numbers, you know, this is what you're doing, and you know, physicians are naturally kind of competitive and perfectionists, and I think it also can just get physicians motivated to make those changes that they will see translate into improvement in patient care.
Federal funding from the Office of the National Coordinator for Health IT helped Colorado Beacon engage 51 practices, more than half the region's primary care base, in a learning collaborative. Physician practices of all sizes learn to develop quality improvement processes and new skill sets. 5 quality improvement advisors, known as QIAs, worked as boots-on-the-ground resources in the practices to help them re-engineer the way they work. Health IT infrastructure supports meaningful use of data for better population health.
I am a solo practitioner who has been in private practice for almost 10 years now, and I came here after using an electronic medical record and swore I would never use an electronic medical record again. And I have a very small practice, and I've always used a paper chart and prided myself on doing good work with it. When I went to a meeting and they talked about the Beacon program, I thought, I know where healthcare is headed. I'm going to have to think about doing electronic medical record again, and Beacon would be a good way of kind of testing the waters. What I didn't know is that I would become someone who is not only using electronic record, is an advocate for it, and also have really changed the way I practice medicine because of it.
What we learned in terms of our technology was that we weren't really using it to its full capability, and our practice coaches helped us learn how to take that technology and use it really to its highest capability to be able to run reports and really dig through the data and find out where there were care gaps, where there were other areas where we might improve the quality of care we provided to our patients.
I feel like our quality improvement advisor has been really helpful in bringing all of us together. Often practices have great ideas, but the process of implementing them becomes much more difficult. The advisor is coming in monthly or every other week to discuss with us what our plans has been helpful in keeping us on track and helping us to find a better way that we might achieve our goals.
Trust in your data and your processes are very, very important, particularly as it pertains to the evolution of technology and the ever-increasing use of technology as a tool. Technology is just that, it's a tool, it's a pathway into our future.
The single most important lesson that I've learned as being part of the Colorado Beacon Consortium is the importance of teamwork. Teamwork, including the whole staff in implementing process improvement and quality improvement, is critical towards our success.
I think that one of the most meaningful changes that I've seen within a practice is just their interest and buy-in in terms of looking at data and making improvements as a result of that. Several years ago, IHI put out a document that was called the Stages of Coping with Data, and it was synonymous basically with the stages of coping with grief. What we found in our Beacon experience is that our practices are very quickly getting through the early stages and very rapidly getting into the stages where they're comfortable looking at their data, know that that's their data, know that trying to improve on that data is their responsibility, and they're willing to take that on.
The Colorado Beacon Consortium has been able to utilize health information technology approaches to change care, has been in working with physicians and physician offices to understand that in order to use information technology, we really need to have a different mindset about approaches to care. We need to move beyond the exam room to be thinking about patient behavior, patient attempts to care for themselves, and really looking at population management as we move forward to really affect and have an impact on the community.
With the tools to better understand health needs, physician practices can improve care.
I recently had a new patient come to my practice who had been in the emergency room the night before complaining of chest pain. So when the patient came into my office, I was able to immediately go into the health information exchange, pull up that information, and make important decisions about the care for that patient on the spot immediately. I didn't have to wait for the data to come to me. I didn't have to wait for paper or faxes, and we made some important decisions that day during that visit, which I believe impacted that patient's care in the short term.
For diabetes, we have a diabetes clinic, we have huddling, we have diabetes classes, and probably most important is just the registry information that we pull once a month on diabetes to identify how our patients are doing. This individual had been managed very well with a hemoglobin A1C of 6.5 for many years. All of a sudden we saw the hemoglobin A1C go up to 7.5. We were able to identify this individual and call her to come in. It was very interesting for this individual as she was going through a family crisis with her spouse and was not able to maintain her sugars because she wasn't able to exercise and diet the way she had. We were able to intervene with medicines until the family crisis resolved and then decrease the medicines back to their other level, getting her sugars back down below 7.
For the past several years, I have been tracking obese patients, their BMIs, discussing ways of change, the stages of change specifically. And with the Beacon, I have been able to now track them with an electronic medical record. But the way that Beacon really changed my practice is at one of their sessions, I was having a discussion about my patients seemed to be very upset when I would use the word obese, and it was a motivational interviewing session, and the woman said, well, maybe you should use the words unhealthy weight. And at first, I thought unhealthy weight call a spade, I should say something that's, this is obesity. But really, the truth is, it was a life-changing experience for me and my patients, because when you come up gently to your patients and can say these things, it changed how the conversation went. The patient felt less shamed. My numbers in terms of the patient weight loss have dramatically improved, and it's solely because of that one little pearl. So Beacon is all about those little pearls.
I had a diabetic patient who has been struggling with their diabetic care, difficulty getting their diabetes under control. I was able to show them, using some tools I have in my office that were part of the Beacon project, how if they were able to control their diabetes in a better way, that their risk of having a heart attack or a stroke would go down a significant amount. And that was very impactful for them, seeing that presented to them visually, and it increased their compliance in what I was recommending.
Colorado Beacon is more than a 3-year public-private partnership. The journey continues toward an accountable care community, embracing health improvements for the population, better care for individuals, and more efficient care delivery.
Being the Chief Medical Officer of Rocky Mountain Health Plans, and also being a practicing physician with coming from a family practice, practicing for 15 years, I recognize the resources that the practices gave to this process. I also recognize that they have discovered through their creative innovations ways to deliver care in a more meaningful fashion at the primary care level. We do hope that the 51 practices that are in the Colorado Beacon Consortium will continue on in some vein with respect to the innovation, with respect to evolving the transformation of healthcare at the level of the practice, with respect to helping us develop the technologies, the information technologies that we need to deliver better healthcare for our community.
In terms of thinking about what constitutes an accountable care community, I think of it as a community where there's attention to health care to individual patients, to looking at the health of the community, to being concerned about the patient experience in their own health care, to having data that can be looked at so we can actually measure what does our healthcare look like, where are we moving, how do we improve. I think you have to be able to measure activities in order to improve them. And then finally, in the midst of all this, to have a concern about how are we going to afford the healthcare, and how do we carry that forward.